and welcome everybody to our October coffee chat. We are so happy to have you all here today. We are recording. These meetings do go up on our YouTube channel. So if you ever miss a coffee chat or would like to revisit the discussion, you are more than welcome to head over to our YouTube channel and revisit the discussions. We also now have live transcript available at the bottom of your screen, and I'll go to the next one here. The bottom of your screen, there is a little CC, and you can turn that on if you need live transcript. And like I mentioned, for the translation and to hear all of us, you'll need to choose your language. So you can click on the globe on your menu or click more, click interpretation, and choose either English or Spanish. And then we also do have chat available. And of course, you're more than welcome to come off mute and join the discussion. Chat is available to, you can join the discussion that way if that's more comfortable to you. And then if you'd like to come off mute, you can raise your hand by clicking reactions and the raise hand function. Oh no. There we go. These are our agreements we like to go through to make sure that this is a safe space for everybody. And so we practice active and empathetic listening and sharing. We do like to challenge the idea, but we want to make sure it's the idea being challenged and not the person. Be both teachers and learners. We want to take space and make sure there's space made for others. The stories we hear stay, and the lessons that you hear from the stories you can take with you. We use I statements. One person speaks at a time, and we want to be here and present now. And here is our check-in question. You can go ahead and add your answer into the chat. Let us know your name, where you're calling in from, and what does Hispanic Heritage Month mean to you personally? For me, it's about learning as much as I can, learning and listening. So again, my name is Laura Jackson. I'm the Director of Community at PFCC Partners. I'm located in Eugene, Oregon. And we're excited to have you all here today. So let us know in the chat what Hispanic Heritage Month means to you. All right, and while folks do that, we'll go ahead and get started. Yes, Emily says it's an opportunity to learn and be enriched as well. I like that, be enriched. Just a little snippet of what Hispanic Heritage Month is all about. It goes from September 15th to October 15th. So we just closed it out, I think it was last week, a couple of days ago, and it traditionally honors the cultures and contributions of both Hispanic and Latino, Latina, and Latinx Americans as we celebrate the heritage rooted in all Latin American countries. Anthony says, a celebration of traditions and beliefs. And Nadine, gaining an appreciation, a little more each year. Yeah. All right, and I think we'll go ahead and get started with our discussion. And I'm going to pass it off to Libby and Anthony.
Hi, everybody, and thank you, Anthony, for joining us. I'm going to give a little bit of background before we dive into our conversation, but this is really today's focused conversation is really an extension of the work that PFCC Partners has been doing over the last 3 years to really expand our efforts at diversity and inclusion to build equity. And we had begun our journey largely with the Black and African American members of our PFA network to really learn more about what's needed, to learn more and listen and work together to design solutions to be really inclusive. As I've said many times, we were really challenged by that group to say, you inclusion is a core foundational principle of the organization, and yet how does that get expressed? And it was a great challenge because the fact was we weren't doing it very well. And so we needed to learn from our community. And this community is so full of rich perspectives that we really need to learn more about each of these groups. And recently I completed a DEI certification program. And one of the things that the program talked about, it was really intended for large businesses, large corporations, not tiny little organizations like PFCC Partners, but the PFA network is really part of us. And so that's our opportunity to follow the suggestion in this certification program. What suggested having special focused conversations with particular populations within our community in order to learn more what inclusion means to each community as well. So it's with that. And I remember, Anthony, I'm so glad that you're here with us today, because I think early on in our journey with you, oh, my computer's, I need to plug in. Early on in our journey together, we were talking about inclusion and wanting to expand, how do we help outreach to different communities that aren't reflected? And you said, well, first of all, you got to have somebody that looks like me you got to start there. And so we started there, but I think we can do a whole lot more. And so I'm excited to get your perspective, your thoughts, and those of others on the call as well, because we need to do better in inclusion. We've added a few things like translation and diversifying our workforce as well. So, but I'm anxious to learn more from all of you. So, with that, Anthony, do you want to just introduce yourself and let everybody know where you're calling in from? And for those who haven't met you, a little bit about why you're part of the PFA network.
Sure. My name's Anthony Sanchez. I'm from Albuquerque, New Mexico. I've been an advocate for a long time, but mostly on the local level. I'm co-chairs on many boards here where I live. And I've been dealing with chronic illness since late 2016. That's when I entered the system. And I learned a lot from being in the system, and I learned that a lot had to change as well. I heard a lot of various things from various people about the current system that we deal with. I didn't believe any of it, but you really can't get involved. And this is a great organization that's full of a bunch of people that's been directly involved in it. So I'm sure you understand what I mean. We're going to talk about this further in question number 2, but I chose to carry on with my advocacy at a national level, not only because I was invited by Libby to do so, but also because I think the Latino population needs a strong voice in many of them. I'm just one that's fighting for not only Latinos, but anybody dealing with chronic illness today.
Awesome. Well, I do hope Anthony has very kindly agreed to be interviewed a little bit today, but we really do want to hear from everyone on the call, and any questions that you have for Anthony, for us. Really want this to be a mutual learning experience. So let's start with question number 1, Anthony, and we asked this of a local group in LA County. What are the most pressing healthcare needs in the Hispanic Latina community?
Well, just like many minority groups, we're affected disproportionately by all the major diseases: cancer, diabetes, obesity, heart disease. And in my opinion, I believe there's 3 reasons. First of all, there's a lack of involvement in people's own care, in taking charge of their care. Second, I believe there's an economic and racial gap in healthcare that doesn't allow us to have the proper access or outcomes that we should be getting. And third, I believe there's a lot of misinformation out there that people take to heart that's simply not true. If you don't mind me extending on that third one,
Yes,
I was
please.
reading. Okay, I was reading an article from Brookings. Sorry, I was gonna say Brookings, and they talk about the disparities, et cetera, et cetera. But in the end, and of course, this is this author's opinion and not everyone's opinion.
Mhm.
But in the end, he suggests that we solve economic disparities and gaps in healthcare by nationalizing a tax on sugary drinks and therapy for all, never addressing the economic issues that we have in America with our healthcare and access to. Because in the whether you any of the choices that I said, it all comes down to a lack of access to good quality healthcare and poor results because of that lack of access. And those are major forces driving the issue. That when I see, this is my opinion, when I see someone say, well, we could do better and solve this by putting a national tax on sugary drinks, and this is my opinion, but I think that's ridiculous. Well, what does that have to do with the cost of healthcare?
Mhm.
You know, and I seriously doubt that the entire Latino population has the old diabetes from drinking sugary drinks. I could tell you from personal experience, as a diabetic myself, getting rid of sugary drinks does not end diabetes. So when they talk about misinformation, that's what you see in articles that they read, and that's what people tend to believe.
Mhm.
And we need to get to the heart of the issue and what's really going on here.
Do you think that, Anthony, if people were more engaged in their care, they might have more information? Would that help them with access as well, do you think?
Absolutely. And
Yeah.
question number two is a great question for that. I'm a
Go for it.
major proponent of being involved in your own healthcare. I
Mhm.
believe your journey to wellness begins at the doctor, but does not end there. And people need to learn to understand it. And if they don't, then they have to accept the limitations that are provided to them. And no one should ever accept being sick, ever.
So how do we support the Hispanic community to engage in their care in that way? I mean, obviously I agree with you because that's what we do is try to
Yes.
get people engaged in their care. But I'm wondering, how can we as an organization support the Hispanic population to engage?
I think that's a very hard question. I think
Yes.
you're already doing by simply providing the platform to do so. The number one factor here is that people are not being involved in their own journey back to wellness. They have to
Mhm.
get involved. And because I have tons of doctor's appointments, I sit in waiting rooms all day long, and I get to talk to a bunch of wonderful people. And I hear things from the Latino community like, well, that's the way we were raised. We weren't taught to question how my doctor or my surgeon, et cetera, et cetera. And
Mhm.
then other people say, well, I'm just one person. How can I make any kind of change at all?
Mm.
Or I'm just way too timid to ever question a doctor or his or her decision.
Mhm.
And man, that's the biggest mistake that people are making. Let me explain. I'll answer your question more right now. I think you're already doing a good job and you're creating a platform to do so. People could take those three excuses that I just mentioned to you, and if they are afraid to do it on their own, then they have something very beautiful like the PFA network where you don't have to fight alone. I if I got the dates wrong, excuse me, but I think I was invited to be on the council last year and then the advisory board
Mhm.
for PFAnetwork this year. And when I first got on it, I was very quiet because it
I
took me by
remember.
surprise. Yeah, right. And, well, there was so much information, beautiful, real life, real time information coming at me. And it was a bunch of great, beautiful minds sharing all their experience, which is a very personal thing to do. But they're all willing to get on there every single time we have a meeting and share their knowledge with you for free. So I say to those people that are shy, timid, if you don't want to fight alone, then come fight with us. For an hour, I have many meetings with you guys, but I love them all. But for an hour, I get to sit and have a conversation with, to me, they're some of the greatest minds in healthcare because they're living the actual problem. They're not reading research data or showing, oh, let's try this, let's try that. No, these are people living it every day, and you can't get better information for that. So if you're shy, timid, or we're taught not to get involved in your own healthcare and you don't want to do it alone, come do it with us because Libby provides a platform where we could all do it together and make the change that needs to be made. At least until the economic conditions surrounding our healthcare change.
Right. Well, I so appreciate your active engagement in the community and reaching out to others as well. It looks like we have a couple of questions. I wanted to ask Maria because I saw her hand go up first, but I'm not seeing it now. Maria, did you have a question or a comment?
Sí, no, es un
Oh,
comentario.
yes, it's a comment.
Yes, please.
Yeah, what I want to mention is like this guy mentioned that it's not only take sweet things or drinks or stop drinking sugary things. The thing is to take classes so they can explain them what they have to do and which ones are the myths and which ones are the realities. For example, sometimes I have people that I know that they said I don't drink soda because I'm diabetic, but they eat pork, they eat tortilla, they eat all the things, and that it makes their sugar levels go up. So they're taking care of the sugary drinks, but they don't know that they're affecting their body on a different way because they're eating, for example, tortillas. It's very good to take classes, nutrition classes, and it's very good that you teach classes to educate. Well, yes, to educate the people and take the myths away and the things that they're not true, so be able to understand more about diabetic and have better control on their life. That's what it's my opinion. Thank you.
Thank you, Maria. Okay.
Isaac, I can't hear him. He's an interpreter, right?
Yeah. Can you hear me? Do you hear me? Hello.
I hear you. Yes.
Anthony, are you in can you hear me, Anthony?
I can hear you.
Okay. Did you choose English for
No, I can't hear him when he's speaking at all.
When you logged in on the bottom menu, you have to choose a language. There isn't a default. So if you chose English, you'd be able to hear Isaac.
Yeah, I did.
I think you can do it now.
Can you hear me now? Can you
Yes.
hear me? Okay,
All
got
right,
it.
go ahead, Isaac.
Technology is wonderful and challenging. I'm really happy to hear from you, Maria. Maria was actually in our office the other day sharing with us her experience as a promotoress in her community. And I think she really has a great impact in her community and teaching classes and bringing people together to learn more information about how to be engaged. I think you guys are totally onto something there. Absolutely. Nadine.
Yes, hello everyone, and I couldn't miss hearing Anthony speak. I look forward to him in every meeting, actually. And you mentioned something about Maria is a primatorist. Could you explain what that is? What is that?
I'm going to let Maria explain that. Maria, can you explain your role as a promotorist?
Sí, claro.
Yes, of course. we are people that we are trained to reach other people. So we take trainings to promote health, like other things, for example, diabetic, colorectal cancer, high blood pressure,
Wow.
and any other disease that they might be around. So we take the classes around, and then we go around the community to teach the classes so people can understand a little bit better what is happening. And on top of it, we work to prevent, so they can able to go to the doctor's visit, to do the annual checkups, to do the exams that they need according to the age, also mammograms, for example, things like that. Anything
Thanks.
that is related to the medical field. We teach people to empower themselves to be able to defend themselves and ask for the specialist. Sometimes the doctor don't want to send them to the specialist. That's are the necessities of the patients. So that's why we teach and we reach the people so they can understand better their sickness, especially chronic sickness, or preventing, or also to prevent so in the future they don't have anything. So, for example, they can prevent diabetics. Well, you cannot avoid being diabetic, but you can make it slow. Like, for example, cancers. Many people think that it's for sure they're gonna pass away, but if you check yourself on time and you reach the first stage, you have many possibilities of live. But if you arrive late, if you don't go to the doctor, the probability to survive is less. So that's what we do ourselves. We give the information to the people and given resources so where they can find the resources. For example, the internet, the clinic, or depends where they have the appointments, other doctors. We teach the people what to do. Basically, that's what we do. I don't know if I answered the question.
Oh, yes, thank you for painting that picture. Thank you. I couldn't let that word go without finding out. But my question to you, Anthony, is you mentioned how people tend to be timid. I don't know if that's a cultural thing. I don't have that gene, but there's a difference between being timid and respectful. And I know that those go hand in hand in the Hispanic culture, of course. That much I know. But what other cultural factors are there that make Hispanic people unique? And conversely, not to put the blame, that would negatively impact healthcare. Conversely, how do you see the shortcomings, I'll say that word, not to be too negative, of clinicians? And what are they doing wrong or seeing wrong?
I don't think it has much to do with the clinicians and what they're doing wrong. Let's take for example, in 2018 there was Medicaid expansion, right? There's no clinician if you don't have access to healthcare in the first place. They expanded Medicaid in 2018 under Obamacare, and they were supposed to grant minorities greater access to healthcare. But in reality, since then, it went from 17% to 1 out of every 4 that does not have access in America.
Mhm.
So their attempts at creating greater access never went through. So there's just a small portion of the people who actually have access to good quality healthcare that
Sure.
provides better outcomes. The clinicians, I don't really see them doing anything wrong on their part.
And what kind of cultural things are unique that people don't understand or ignore?
That's a good question. I don't think they're cultural things. I think everybody has these perceptions of, they created perceptions for everyone that is just not true, especially in healthcare. I don't think it's a cultural thing. I think everybody, they create like these bias papers and research and stuff like that, and they make people believe that things are a certain way when they're not. Like Maria said, I think it was Maria who said it. It's good to do preventive measures, but what good is it if you don't have access to healthcare, right?
Sure.
I mean,
Sure.
what you could prevent stuff, but they need treatment and they need better results through better access to health.
That's the common denominator.
Yeah, I think that's portrayed on everyone. That
Sure.
nowhere in this article, and it's just I read many. I actually read 10 before I came on here, but nowhere in these articles is anybody mentioning the economic conditions surrounded the profit-based healthcare system. I mean, everybody wants to say, "Oh, quit drinking sodas or don't eat so much," and yeah, they are factors to maybe future health conditions, but they are not the key factor driving these diseases. And until people start speaking up the truth to what's really happening here, things are not going to change much. Let me tell you about Medicare and expansion. I was reading about that. They did expand it, just like he said, under Obamacare. But the qualifications for it was, I'm embellishing here. You would have to be like a mother of 9 children to qualify, right? You have to be so poor to even get in it. So most of the minority community, they work hard, so they make a little more money and never qualify. There's a lot of realities and truths not being spoken about.
Well, I'm grateful that we have the space here to begin to speak to this, to some of these. It's really illuminating a lot of the reality, and that's really what we're interested in. And you know, and of course, how do we work as a community to improve conditions, improve those the collective voice around what's going on. And I noticed too, or at least I wanted to mention that when Maria was speaking with us about the Promotores program, she did mention that they do quite a bit of outreach to help people get enrolled in Medicaid in California, which is called Medi-Cal. And that's a great service, because there are actually a lot of people who qualify who don't necessarily get enrolled. Again, access and difficulties in navigating that whole system. So, all right, I think Beverly had a comment, and then I'll come back to Maria as well. So Beverly?
It's so good to see you, Anthony. And I was so glad when you started to speak up. Just a point on you're talking about, you know, sugary drinks and diabetes. It's a shame that they should say that when they know that it's carbs that cause the sugar. So they didn't tell you to stop eating tamales or Spanish rice or any of those things. They focus on the sugar drinks. But beyond that, when Libby was asking about how we could help, one of the things that some folks don't know is that my son married a young Mexican lady. They're not young anymore. They're in their 50s. And her name is Navarez. And Maria is a firecracker. So when she goes to the doctor, she takes the kids to the doctor, you know exactly who the advocate is in the room. However, her mother, who is old school, is very quiet. And she is very laid back and very accepting. And I'm wondering how we help those who really, and I think the reason that she doesn't speak up is because her English is not all that great. And many of the physicians and Americans as a whole are not very patient when they're trying to listen to someone who is not speaking the English that they understand, you know, the rapid fire English. How do we help, besides beating us over the head and saying you need to listen? How do we help you guys when, you know, encourage you to just keep speaking and we're listening? It's easier for me because I did take 4 years of high school Spanish, and when you cross the threshold, you didn't speak English. So I had, for the 4 years, I had pen pals, and I was immersed in Mexican, Spanish, Portuguese, whatever. And then when I came out, I did 3 years as an interpreter in Milwaukee Public Schools. So I do have a tendency to want to listen more. How do we help? How do we help foster the fact that we want you to speak up. We're going to hear you. We're actually listening. How can we do that?
A great question.
Yeah. I knew they were coming. There's no way we could show them ahead of time before they ever get involved. They had to get involved and see the changes for themselves. They had to believe in themselves. Not to go off topic, but any profit-driven system is based on supply and demand, right? But that works both ways, right? Demand creates change by pricing, and it also creates change by people's demand and what they want. So if you want something to change, you got to create the demand. And the only way you're going to create that demand is to get involved in your own care and to get involved in national advocacy programs and platforms like this one. And there's other ones. This is one of my favorite.
Mhm.
But that's the only way to do it. If you don't create the demand, they won't change anything. Why should they? So the way to create the demand, to get that access and to get those prices lower, is to demand it. And you could demand it in a very professional, mature way through advocacy.
Thank you, Anthony. And I do think it's a great question as well. And I see Doris put something on the chat. Doris, did you want to speak up and share your ideas on how we can be a supportive community to help people who are speaking Spanish primarily to feel a little bit more confident in speaking up? Yeah, go ahead, Doris.
Hi, can you hear me? Because I just finally got home. I was driving, so I couldn't
Gotcha.
speak. Okay, but now I can, and I lost some of the context. But I am a proponent, as a few of you know. I am a certified teacher. Spanish is my native language. I have a bachelor's degree and a master's degree in foreign language education, and I am currently working on a 3-year national project around language access for providers of health providers, especially and specifically for families of children with and youth with special health care needs, but for families in general and patients in general around the nation. And what's daunting is our people need to advocate and speak to their legislators, know what their rights are. There are organizations in every town, in every county, in every city in the United States. I know of many organizations and family organizations that have at least one organization in each state, like Family Voices, Parent to Parent. There are DD councils, so developmental disabilities councils. There are disability councils. And of course, there are ethnic councils or organizations nationally to reach out to. We have a national, since COVID came about, there was a movement to certify community leaders nationally, and we were called trusted messengers to get the messages out. During that interim of COVID, within the past 3 to 4 years, the promotoras, and they're also on the East Coast, were known as community health workers, but promotoras, promotores, community health workers are certified, and we're vested in the communities, we're in the faith-based communities. So making sure that we have information available in those communal living, because as Latinos, as a Puerto Rican, I was taught that my community is within the faith-based community and our neighborhoods and our families and those our elders. So trying to get our families educated in that aspect, and our children that's why I became a teacher, because my children have special needs. I was born with disabilities. So I was going into, one of them has autism, they have developmental delays, and I'm a foster parent and an adoptive parent. I'm in the court system for foster children with medically complex needs and the families. And to educate our children how to advocate for themselves, to be at those parent-teacher meetings where they have to, by mandate, they are supposed to provide an interpreter. Interpreters are different from translators. There aren't many translators out there. Sometimes the interpreters will translate materials, but what I've come across is the hardship as a linguist, that people think that Spanish is just Spanish and we can Google translate everything, and you know, that's a checking in the box. Spanish has over 10 different dialects, and with those dialects come other dialects. So there's that, and there are other languages I've come across that also have different dialects within the Chinese language, Vietnamese, with a project that I'm working on right now to translate information for families with special needs. There are those intricacies, and we can't just say, oh, well, we have a Spanish speaker in the office, and okay, come over here and translate this for us. No, and the problem too is that in healthcare, and in the statute and its law since 1964, we're supposed to be provided trans interpreters from the moment that we're trying to set and schedule an appointment, all the way during the appointment, after the appointment, follow up with the appointment, the transportation to get to the appointment. And no one really understands that or knows that they're being afforded that. And it doesn't matter if you are undocumented or documented, it's a right, and no one really knows about that unless we as advocates and as promotoras and family members go and say, this is wrong. We need to do better, and we're doing better, and how can we do better? And there are always pockets of leaders in our communities. There's been also a big move for DEI is not just diversity, equity, and inclusion. It's supposed to include access, and that access is for those with disabilities and with language access. And people aren't combining and they aren't seeing that we have to be separate but equal, and that's where equity gets lost. And I'm sorry, I could go on with this for hours.
Well,
That's great.
yeah, it is. It is, Doris. I truly appreciate your perspective as always. I think, you know, it's daunting in a lot of ways as a leader of an organization that's working really hard at inclusion, but has incredibly limited resources. I often find myself, because I'm aware that there's so many different dialects with every language, really. And even if it's not, you know, how words get translated, sometimes it's just, you know, the terms that are used or the slang that's used. So there's so many different aspects. I struggle as the leader of a small organization with limited resources. Is it better to offer translation to Spanish on some of our programs, recognizing that we're probably not going to meet the needs of everyone? Or do we, you know, miss those opportunities in search of sort of perfection? I always struggle with that, and I'd love to hear anybody's thoughts on that idea. So I like Doris, you put in the chat, not via Google Translate. And I know Google Translate is not, you know, perfect, but it is something that we as a small community can access to help us to communicate with English as second language learners. So, but I struggle with that. You know, Laura, we always put that disclaimer at the bottom. We know this isn't perfect, but we really want to communicate with you guys. So where is that line? Is that, yeah, curious what your thoughts are.
I can't see really if anyone else is trying to, but since you mentioned you mentioned my name, and I have
go ahead, Doris. Yes.
There are answers to your questions, and it's not the 100% answer. There are other options other than Google Translate. There's DeepL. There are other resources that are free. There are all other resources that are more costly, but there are resources out there. It's a matter of doing the research. And how do you do the research if you're not in the community, or if you're not,
Right.
really privy to it? Is you ask. And this is one thing that we've had conversations and with the PFC and with the providers. It's a given. You offer the translation and you say, we have this, but if anyone has any other suggestions and would like to, or knows of someone who can or certified, then if you put the effort into it and ask the questions, ask the people with lived experience, then they can't come back and say, you never asked me, or I was never included. You're speaking for me and you're not speaking for me correctly on top of that. So I would ask, because every community speaks and has a different rhythm and understanding on what their needs are and how to communicate proficiently.
Thank you, Doris. And I will say this entire session is about us asking. So thank you. I appreciate that space to do that. Maria, I think, had a comment.
Sí, quería comentarles.
Yes, I want to mention the same thing that she said. The thing is that right now, like where they're saying the things that we need, and you as a clinic that you worry about the community, that's what you're looking at. So when we talk in this case that we need a translator or an interpreter, and most of the health plans, they give you an interpreter for your doctor appointment. Also, it's not also medical for the people with less resources. Also, Cover California, they can qualify for Cover California in case they make more money. We're also advocating that almost everybody that has work that makes a little bit more money, or they have more easy, so they can have insurance through Cover California, or their work is not only medical or Cover California, it's also the other insurance. And we had to keep fighting, because I believe that everybody and all of us deserve healthcare services. And if we have health, we have everything. But if we don't have health, we don't have money, we don't have work, we lost our loved ones, we have many problems without health. So the question is that to look how we're going to be healthy, and how I'm going to look for that resource. And that's why we had to help people to understand if it's a way to look for help, and to learn how to advocate for ourselves and show our necessities. And sometimes I say it in my position myself, because I've been many years, I haven't learned English because I don't know, because I can give you so many excuses, because probably it's more comfortable for me Spanish, and probably I didn't have the necessity of learn English, but I find my resources, because that's what we need, be able to notice ourselves of what we need. Like, thank you that you are thinking about us, because it's been many progress, because many years since I arrived, they always giving my interpreter. Sometimes people don't have insurance. There's many factors that they're changing on a positive way, depends on the demand through the years. And we had to say thanks for that, and we had to keep moving forward to have a healthy community. Thank you.
Thank you, Maria. Any other comments or questions from others? Sal, I haven't heard from you, or Emily, Nancy.
Hello.
Hi, Sal.
How you doing? Yeah, this is so informative. A lot of stuff that's been said I was thinking about, such as the undocumented population, the fear that's out there. I'm also thinking in terms of there are Latinos, Hispanic, I don't like the word Hispanic, but whatever, Latinos out there who are they may be bilingual, but they're monolingual English and have issues with health. You know,
Mm-hmm.
I think to be in a position of advocating for yourself, abogando por uno mismo, you know, you need to be in a place, I think, emotionally or whatever it is, to say, I count. My health counts. My mother was one of those kind of people. When she was a little girl, she had to translate for her parents.
Mm-hmm.
Her mother from Mexico, her father Espanol, and she was always pushed up to the front to translate. Thank God we're not living those days anymore. I hope. But she learned to advocate for herself. She was very active, an active participant in her own health, and the doctors listened to her because she was really present in the room.
Present in the room.
And that's so important. And you can do it in your language. Also, I think it's more than just bilingual; it's bicultural. Now, in the case of Spanish speakers, okay, you can have a person from Mexico, but then you can have a person from Nicaragua, a person from Paraguay. The language is the same, but there are the cultural issues that go on. I know that in our situation, many of us, the Latinos, diabetes is a big thing, and I don't know. It's like we just had a health fair yesterday, and that's a good way of getting the message out to people. Throw open the doors, bilingual English Spanish. In our case, throw open the doors, informing people, having presentations. We live in a rural place here. It's very, very hard, really hard, and we're isolated. We're not. You just don't jump on a freeway and go to the next community.
Right.
Yeah, to meet these kinds of challenges at the same time, and then there's the issue of the baby boomers. In my case, so many of my friends, and in some case family, but certainly friends, baby boomers are in such terrible shape. You know, born and raised here. They're, you know, you see them in walkers, you see them in wheelchairs. They're taking 15 medications, and it's like, what needs to happen? You know, I don't know. Are a lot of us over the hill that show and talk to us and don't make any? I have a sister like this, and it's so scary. Now, I said this in another forum, someplace, that for us baby boomers, people who are retired and who have Medicare and the supplemental, I really feel I'm a huge advocate for looking for therapy, talking to somebody. What are the issues that you're facing as a 65-year-old, a 70-year-old? To talk to somebody. I did this, I think, I've been in therapy now for almost 2 years, and I've noticed that a lot of my health, what I see as health issues, are connected to other things other than physical health. And I have a dog that won't shut up. If you'll excuse me, I've got to let him out. Hold on a moment. Okay?
Yeah. I don't have my dog attending today, but my grandson is.
I'm a big promoter of this kind of therapy, what I call Medicare and my supplemental. Of course, I have an insurance agent. I said, I want to get into therapy. I feel that some of the issues that are going on with me are connected to other stuff, just beyond the physical.
Yeah.
I had hay fever. I had asthma. Asthma is coming back, and I'm thinking, you know, I'm going to find out what's really the cause here. Anyway, I'm going on and on. so many things that I've heard this afternoon that, oh, my goodness, it's a lot. And I applaud you for what you're doing, because it's like, you know, you've got a plate with 3 sections. You've got 6 or 7, you know, in this plate, you know,
Yes.
a lot going on. And
Yes.
anyway,
I appreciate hearing from you, Sal, every time we talk. And you know, this is what this conversation is about, is just bringing awareness to us, but awareness, this is my problem. I always jump to solutions too fast, and I'm going to do it again here. What ideas do you have on how we can better, as an organization, as a community of patient family partners, how can we be more inclusive of the Hispanic, Latina population, and help to provide the information, help to bolster the empowerment so that people can speak up for themselves or engage in their healthcare differently? You know, just
well,
very
maybe
basic things. I mean, even going back to what Anthony originally said, you don't have anybody who looks like me on your website of all the pictures. And so what other things can we do that, you know, even if they're long-term, and we've got a lot of long-term things to work on with different languages and dialects and cultural norms for all sorts of people, but long-term and short-term, what can we do? Any ideas? And
well, I think these things need to happen more often. This thing about Hispanic Heritage Month, why is it a month? The calendar has 12, you know?
Gotcha.
So
Okay.
why do the African Americans have February? Why do we have September? And why do the Chinese and Vietnamese have whenever they have it? You know, there are 12 months in a year. What happens the other 11 or 10 or whatever?
Yep.
So
Hear you.
that the presence is felt in these communities on an ongoing basis. We have one in July, we have one in March, we have one in October, whatever it is, you know, because health is health, you know. And this is just going to get more critical as more baby boomers, you know, impact the system. They're already impacting the system. So between the undocumented population, the people who are addicted to alcohol and drugs, bad diet, I don't know. I don't see it getting a whole lot better. You know what I mean? So I don't know if that answers your question, but that's every time I see, you know, this is Hispanic month or this is Black month, you know, okay, that's nice. What happens the other 11?
Gotcha. Consistent effort. Okay. I can take that. Anthony, do you have any ideas?
That question's loaded.
I know.
In the short term, Sal's absolutely right. Just keep doing what you're doing, and maybe you could even have a Latino meeting once a month or something like that. But in the long run, I think it's not a question that could be answered right away. It's more like a project we should create and start working on, as in recruitment and getting them to learn about things that this awesome network can provide and teach. No easy answer, but I think it should be a project and start getting all these great minds together and figure out a way to make this recruitment issue bigger.
Well, we would need you guys to help us, because I have learned that I can't, even with the best of intention, walk into a community of color and expect or anticipate that I'm going to have that sort of credibility. So I need the leaders like you to help us, definitely.
Well, I can assure you that I'm not going to be quiet. I tell everybody.
I'm
There's
glad.
a lot of waiting room time, you know what I'm saying?
Absolutely. Thanks, Anthony. Doris, did you have an idea or a thought to add? I know we've just got a few minutes left.
Yes, I have a couple of ideas, and it's basically addressing our lifespan. And I always advocate for the youth voice and component. We need our youth not only to serve as interpreters because they have in the past, but they are the future, and they need to know how to advocate for themselves and their communities. We need interpreters that know the difference between third person and first person. That we need to take ourselves out of the equation when we're interpreting for our family. It has to be about that family and not about the interpreter and the provider. We addressed this in the PFAC regarding the role playing and providers thinking that it's okay to bring in actors instead of people with lived experience. So advocating that is a best practice to have an actual person and people with lived experiences. Addressing the mental health stigma, because among Latinos, there's a serious mental health stigma. Many of us suffer from cultural betrayal trauma because we have our disability and then we have our culture, and then as women and men, we're supposed to hold it back and hold the fort, especially with the machismo and the male dominance. They're not supposed to show their emotions, and then the women are left, holding the reins and becoming completely disheveled at times. There's a high propensity of domestic violence also for both genders or all genders because of the disparities and social economic disparities. And also support groups. I don't like the support groups. I will lead a support group, but I don't like because we're very personal and we go back to our faith communities. But there's also a movement nationally for peer support workers so that we have someone that's trusted, that can relate, is relatable, and knows about our culture and our norms, or at least closer to the fact that a clinician that has no vested interest in our community or knowledge of our community. Thank you.
Thank you. Yeah, thank you, Doris. So much to think about. I really appreciate it. Anyone else? We've got just 2 minutes left, but does anyone else have any ideas or comments? All right. Well, in that case, then, what I would like to do, again, I opened by saying this is in the context of we really want to create these very focused conversations so that we can better understand the needs of our community and the needs of people who haven't found our community yet. And so you've given us so much to think about. And Anthony, I appreciate your leadership in this and everybody else's comments as well. We PFCC partners will continue these conversations, and Anthony will have some more discussion on that concept of having regular meetings of the Hispanic, Latino, Latina population within the community. In addition, we're also going to reach out to members of the community who identify as LGBTQ+, as well as some other special populations within our community, because we really want to live our value of being inclusive and recognize that our understanding of that is limited and we need to learn from and with our community. So I thank all of you for being such great leaders and sharing with us today. I hope you all have a wonderful weekend.
Thank you. Thank you very much.
Thank you, as always, Isaac.
Bye-bye.
So long.
Gracias a
Thank you.
todos. Hasta luego. Buen fin de semana.
Thank you to everybody. Have a great weekend. Thank you.
Thank you too.
So long.
Bye.
And thank you, Emily. If you're still on, we will definitely
Thank you,
be
Emily.
in touch.
Yes.
Gracias a todos. Bye.
Maria says
Thank you
thanks
very
to
much.
everybody. Bye.
Thank you, Maria.
You-